All right, it's 5:30. Let's call the Mandan Public School District Number 1 to order. It's Monday, May 6th. It's 5:30. Please join me in the Pledge of Allegiance. Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Next item is approval of the agenda. Is any changes to the agenda? No changes. Any changes from any on the board? Seeing none, could I get a motion to accept the agenda? And we have a motion. We have a second? Second. We have a second. Any discussion? Seeing none, please call roll.
Hogan?
Yes.
Gazette?
Yes.
Peters?
Yes.
Keel?
Yes.
Rector?
Yes.
Burris?
Yes.
Horn?
Yes.
Wolf?
Yes. Next item is public communications. Anybody in the audience like to address the board? Anybody like to address the board? Seeing nobody moving, we'll move on then to the administrator's report. On the administrator's report, the first item is the near-site clinic. Mr. Legacy,
I'll take that. Yeah, I'm happy to have Noel Reel here from Medallis Medical to present on the near-site clinic that we are hoping to approve tonight. Noel has presented to our health insurance committee, I think back in January. That's when we presented, and we've been working through the contract. So she'll present on the clinic, kind of the overview there, and if you have any questions on the contract, I'd ask you to ask them now. So Noel, I'll turn it over to you.
Hello, welcome.
Yes, thank you very much. Can everyone hear me okay?
Mm-hmm.
All right. Like he said, my name's Noel Reel. I'm the nurse practitioner, medical director and CEO of our Jamestown location, and soon to be our Fargo location that's going to be opening here in about 3 weeks. I'm just going to give a brief overview about our clinic, what we are, our mission, our vision, and how it became about that the Mandan School District had contacted us in regards to opening a near-site clinic here. So just a little bit of a background about ourselves. Dr. Rashat is also a co-partner of mine. He's the one that actually founded Medallis altogether. He operates 9 local operations in Utah, where he is from, and then I operate our North Dakota franchise district. So right now, currently Jamestown, soon to be Fargo, and hopefully in about a year, maybe Mandan here. So a mission on why, or our vision on why, is that Dr. Rashat had worked in the hospital setting for many years and found that healthcare costs were rising exponentially, and the patients were having difficulty paying for their services. So he became and devised a plan to offer cheaper medical in local community centers that would provide all of the necessary treatment remedies in one building versus sending them out to multiple avenues. And this has become what has become our near-site clinic and our hybrid near-site clinic. Jamestown was the first one to operate or take on our operation here in North Dakota. And the reason that they had sought out our industry and looking at our clinic was for that they only operated with a local emergency department on the evenings and weekends, and the clinics were only open between 4 and 5 o'clock. And so anybody that needed health care after that or on the weekends were sent over to the emergency department. So your child with an ear infection or a UTI, they often had to utilize the emergency department on the evenings and weekend, realizing that they couldn't wait to be seen in the urgent care or in their primary care clinic, but not necessarily needed to bombard the emergency department. So that's how we were formulated and developed a plan and process at the Jamestown area, and we developed a clinic model for them that came to zero cost to the actual employees themselves if they were utilizing our clinic, and the employer was set at a local fee. And then we also looked at the standard CPT codes, and we developed a fee for those individuals at the Jamestown Public School District. Right there's just a picture of our local clinic before it was completely remodeled and redone, and the outline of it. Fargo is set up very similar to that. We believe in a holistic approach and seeing our patients as much as we can, so it's in a U or a circular shape so that we can utilize and see all of our clinic indoors as necessary. And what does this mean for all of those that are financial savvy versus medical savvy is huge cost savings for the employers and the employees. In Jamestown, from 2019 to 2021, we saved the employers $555,000 by utilizing our clinic versus submitting it over to either Blue Cross or the Sanford healthcare insurance companies. And how we do this is we develop and devise what we call a dummy code, so it gets sent off and still billed to the carrier of choice that that employer uses, so that they would see what it would be billed at. So it's not numbers that we look at, it's not anything that we do in-house, it gets sent off to them. And then, obviously, the itemized bill report that the employer gets. And so that is where that cost analysis came up with. Right now, in 2022 and 2023, we're seeing that number almost triple. So the school district is already seeing a huge increase in savings because we've been in the community longer, and those employees and their dependents have been utilizing our clinic much more now that they know what we're about, why we're there, and who we're there to serve. So it's been a great opportunity, and like I said, for the employers, it's a huge cost saving, and eventually, hopefully and ultimately, it can give back to their employees at the forefront versus behind the scenes in healthcare. So our philosophy is excellence in healing patient care every single time. So the patients that we're going to be serving in our clinics around the state are between newborn, elderly, the dying, and before pregnancy. And our types of services that we offer and that most of our contracts are doing are urgent care, primary care, mental health, and telemedicine. So those are the main platforms that we utilize. And again, we are a general medicine, so it's not that we will have, say, a cardiologist on staff or a psychiatrist on staff, but we do have family practice providers that will be able to encompass all of your general healthcare needs. And so as often, many people will hear, we're the gatekeepers to all of your other healthcare. So if you need to get off to a specialist and things like that, we start the process and we can formulate and we just bring the holistic approach back. So the types of primary benefits that can help in what we do here in the near-site clinic is I already kind of covered that. The employee benefits, it's cost saving, it's the chronic and primary care management, it's the urgent care needs and philosophy. It's also if we need to do that specialized care that we are getting that closed loop communication versus sending out to 5 specialists and never getting that information back, and no one's really knowing who's doing what, and we're on 4 new different meds and not being able to have that closed loop. And we know that what we're treating for rheumatology and our urgent care needs may not be the same as if the cardiologist needs to start them on new meds. So just being able to encompass that whole approach. And again, cost savings then to the employer because we're able to reduce the risk for complications and side effects of different things. Right here's just a quick brief rundown of the primary care services that we offer. It is, again, all the same typical primary care services that you would see, say, at the Sanfords, Essentias, St. Alexius's, any of the other ones that are out there. So really nothing different, nothing special. It is the standard of care that is provided at any type of clinic. The urgent care process, this is where it gets a little tricky for a lot of individuals because they feel that urgent care or walk-in clinics can't do much. We are licensed at the highest capability that we could possibly do outside of emergency department. So we can do on-site x-rays, we can do splinting, we can do casting, we can do sutures, we can set bones if we don't need to have them have like a moderate sedation or anything like that. We can also do workman's compensation. Employers really enjoy that we are open 7 days a week. So if we have a workforce injury, we can do the first report of injury, and we can also take care of those drug screens and or contracts that require them to be taken care of versus going to sit in an emergency department for 6 to 8 hours while they're, say not emergent, just needing that drug screen, but they obviously have to have that done before they get back to employment. So just another opportunity to utilize our clinic versus having to sit and bombard an emergency department or have half of your day wasted because it's not considered an emergent situation and that they need to take care of those life-saving measures first. Other services that we offer within our urgent care that's really some small handwriting is that it just simply says that we do CLIA-waive and non-CLIA-waive things in our clinic, and what that means to the layman person, we can do a lot of laboratory exams within our clinic and we'll get instant results within the same visit. So we can do CBCs, CMPs, we can check for an influenza, your RSVs, your COVIDs, your strep, so your urinary tract infections, your lipid panels, your A1Cs. We can check all those right there in the urgent care setting. So again, not having to wait, not having to send out those labs. If we do need to send out labs or anything like that, we do have certified labs that we work with around the nation and locally in the state, so we are able to send those off and get them back in a reasonable amount of time. But again, just there's a lot of added benefit that we can do a lot of the different types of services within our own umbrella and our own window. Some of the procedures that we can offer too are x-ray, casting, splinting, the staples, a wart remover, incisions and drainage. We can do multiple days if we need to do IV antibiotics or injections, so you don't have to sit in a infusion center, which has been very beneficial for many as well. And a little bit about our patient care coordination. So often they'll ask, why do we choose you versus, say, the bigger hospitals? We're independently owned and independently affiliated, so we have great working relationships with all of the tertiary hospitals. So meaning the St. Alexius, the Sanfords, the Essentia Healthcares. We don't have to feed into one particular organization. So those offer the flexibility to specific employers that if they are in a agreement on their insurance contract for in-network or out-of-network, we are able to funnel and or refer to those local institutions that the employee and the employers can receive the best reimbursement rate with if the appropriate care is at those tertiary centers or within that in-network setting. And a little bit about our data analysis with this too is, so if you're not affiliated with the big hospitals, can you provide the same data and claims from a reporting standpoint? Yes, absolutely we can. We utilize what we call a Springbuck system, and that just encompasses all of our claims that we can provide in this system. It's a third-party vendor, and they will give us back our quality measures, how we're doing, the types of engagements of our patients that we're seeing. They will also do some didactic of amount of the patients that we are possibly missing, the ones that are not engaged. If we have a coronary artery dysfunction or disease process, so a hypertension type patient, and they've only been to one appointment out of 6 that they should have been on the normal care standards, this report will give us a blind setting of the information back, and so that we can look that patient up and provide them some follow-up calls and information of being what is our limitations and why are we not able to get the patient in, and how can we better engage them so that their health care is improved, their outcomes are improved, and again, lowering the risk on the healthcare system, because if they are following the normal care and are staying up to date with all of their medications and appointments, hopefully their risk factors will be decreased and they'll be living a healthier lifestyle. The other information that we always like to tell everyone, because it is the newest thing, is the technology and reporting system. We utilize an EHR called Advanced MD. It's a cloud-based. It's also got encryption, and it's also got cybersecurity. That's our biggest thing that everyone's talking about, is all of the different data breaches that are out there. So it is fully funded, and it is a fully encompassing, encrypted, monitored 24 hours a day, and that there are people that are continually funneling to ensure that this EHR system is in a safe model. Again, could it be potentially hacked? I mean, any of our stuff could be, but they do ensure that they do follow it on a regular minute-by-minute basis, and every 24 hours it's updated and the encryption is changed. So that is always a great peace of mind for all of us when all of our data is sitting out there for others to have their fingertips at. So a little bit on the financial model that individuals are often very curious about. The clinic itself is, well, again, how does this save the employer, and how is Medallis making money, and how is the insurance companies making their money, and how are the patients, number one, being cared for the best? So how the patient is taken care of on the front end by my providers and my nursing staff is they have no idea about the billing system and the backsiding. So the care that the patient is received at, that is part of our district, that's part of the general insurance, or that comes in as a self-funded self-pay, my providers and nursing staff do not know anything about the backside or the encompassing. So they are highly trained individuals that care for the patient to the best of their ability and to their education. And on the backside, then my administration handles the fees and the contract modeling with the different districts. So what we had set up with the Mandan School District is a set fee per person per live in the Mandan system, plus then we do a fee for business when they come into our actual clinic. And that's again when I kind of talked about those DEMI codes and how we send out the billing. Everything is itemized and is always an open book at any point in time. Jamestown has audited a couple times just because their numbers were a little bit off, and we were able to provide that within 24 hours, and we were all able to see that where the miss was and whatnot. So it's a very open book system. There is never an opportunity for any sort of hiddenness. The only thing is that it's always blinded so that patient confidentiality is always number one, so that the district does not have access to the physical patient's names or anything like that, but they will have access to the financials related to that.
Ms. Reel, can I ask you a question?
Yeah, go ahead.
Because you happen to be on the slide here.
Yeah.
It says $16 per employee per month administration fee up there in relation to it. And our contract says 12.
Yes.
Could you explain the difference there?
Yeah, so we have switched our model to the 5-year plan at the request of the district versus the 3-year plan. And so after year 3, normally we go up to the added fee based off of where we're sitting with what the practices are. And so since we were looking at the 5-year, the CMO or the CFO had looked at that and said that that's what the contract would be going up to.
So is that a change from the contract we have in our deal here? Because it says 12 in here yet.
Does the new one still say 12?
I just want to make sure we got it clarified before we do
Let me double check before we act on the contract.
Go ahead.
Yes,
I'm sorry.
absolutely. Yeah, and I can reach out to him tomorrow too and just make sure. And it was all kind of shifted from when we went from the 3 to the 5-year. Right here on the 3-year visit billing, I bet you we'll have to just reevaluate that as well, just to ensure that we have the right numbers because we have switched it over to the 5-year. And then what I had talked about with the time-based models, those CPT codes, this is just a quick overview of how those are done, and this is based on all insurance carriers. This is nothing specific to the school district or anything like that. The service is not included unless it is set up by the school district, and the contracts are normally registered dietitians, the wellness vendors, pass-through medications, the DMEs, orthotics, COVID testing, x-rays, if you need to get sent out, and also behavioral health specialty. The school district has opted to go in on most of these items, so this really isn't of relevance to yours, but this is normally what the contracts look like without it, and this is all outlined in the actual physical contract that the school district had wished to be part of. And this slide is just, again, the breakdown of it, and if we have questions or want to go over in great detail, I definitely can later. It's just, again, this is just the itemized of the actual CPT code and the time with it, and that, again, it's the standard across the nation on this one. This has nothing to do specifically with the clinic at all. And this one, we just had broken it down into where we were looking at for the near-site clinic. Some of those numbers have changed due to the contract timeline as well as year-based salaries and things like that. This was just an example on here. This is not in the contract either. This, again, was just an outline when we did the school breakdown of what potentially the cost would be. This is not a final. This is not the actual proposed. It would have to be based off of the school districts and our team to look at where the building would be and all of that. This was just a rough estimate. We were looking at a 3,500 square foot facility and then the types of items that are in the clinic. And I can already say that our costs from the start of Fargo to the finish of Fargo has increased substantially based on just the market value and the supply and demand in the nation. So those numbers will be ever evolving, and we've been working very closely with our Fargo district as well on different items, especially ones that are specific to their needs and their desires.
I'm going to just interrupt real quick and just let the board know that we do have a commitment to cost share with Blue Cross Blue Shield to help with these startup costs, just so you're aware.
Oh, no, you're fine. Right now, the estimated time frame, if we were to be building for the Mandan School District, is the estimation of May of 2025. And the reason for the long haul was to ensure that our Fargo operation was up, running, and was smooth. We are looking at opening our Fargo location here within the next 3 weeks. And we hopefully will be able to then, right after that, start with the Mandan operations and moving forward if we were able to. So hopefully that May 25th is a long shot, and we would be able to open before that, but just depending on the procurement of a building and the funding and how fast we're able to get contracting and the start of construction is kind of where we would be sitting. But other than that, this would be, knock on wood, our third time go around, and we've got a pretty good, smooth operation, and things have been going fairly well from that standpoint. It's just kind of sitting with the contractors. A little bit about our Medalis weight loss wellness program that they wanted me to just to kind of do a quick overview with that we've been picking up across the state. As we are well versed that our nation has a huge shortage in the GLP and the GLP-1s by the names of Wegovy, Mounjaro. Those are medications that are marked by pharmaceutical copyright brands, and they become a huge shortage and also a huge cost to our local insurance companies and employers. So Medalis Medical has been working with a 503 compounding pharmacy to come up with the peptides that are within the active ingredients that Ozempic and Wegovy and Mounjaro have. And so we are able to offer a wellness program that mimics the same as what the diabetic and the weight loss medication is to those that cannot get the coverage through their healthcare services anymore. And so just a little bit about it. It's just some general information for those that would like to read up on the GLPs and the GLP-1s. Also what a compound is of semaglutide or tirzepatide. Again, that is the active peptide and formula that is in the pharmaceutical pieces that are out there that are on a shortage. And then just a little bit about what positive effects they can have on the body, not only the weight loss, all the other different organs and functions that it can improve for the patient. And just a real quick, fast rundown of what we can offer and how we're doing this in a statewide approach is we are doing the wellness weight loss program of this. And so what this means is that they can call directly into our clinic. They'll go through a rigorous process to ensure that they do meet the national standards, they do meet the local standards, and that they don't have any contraindications of why they shouldn't be on this medication. And depending on the district that is contracted with us, if they have a cost share or if it's a zero cost share. We have anywhere from zero cost share to type 2 diabetics that are currently on it. And also some employers have opted to pay 100%, so the employee again has a zero cost share, while others have, depending on their insurance and their healthcare plans following the Medicare and the federal guidelines, they can have up to 250 or a 700 cost share with this throughout the entire program. And what will happen is that we do the labs, we send the kits and everything directly to the patient's home. They will complete them, they send them back into our laboratory, we get the results. Once that's done, they'll do a consultation with our trained medical staff. We'll go over everything on a telemedicine visit with them, and the prescription is completed through the 503B compounding pharmacy. After that, we ensure that we are following the standards and that they get a call back every 2 weeks, so they are not left on this journey alone. So they follow with highly trained medical staff, as nursing being the main contact, and then also our providers also will be making follow-up calls, and then they have access to dietitians. Right here is just a quick rundown of the pharmacy pricing depending on a couple of the different matrices that we've utilized on a few of our contracts. So it just depends. Like I said, some of it is the diabetic is a zero base to the employee, and if they're utilizing it for the anti-obesity weight loss, it just depends on if you're on the high deductible or if you have a value base. And again, all of that information is provided to the district as they're onboarding with us to ensure that we're following all the standards, the local standards and the federal regulations. And then this is, again, how we do the breakdown of that. It's just the cost share of just showing you that we follow the same CPT codes and the standards and guidelines with that and what the actual physical cost. So this is, again, just your line items that you would see. The next few pages, I won't go over them, but they'll be available to anyone who wants to see them. It's just a frequently asked questions that we've been having from the districts that have been joining on board. And so that is the fast rendition of our near-site clinic. One that was an hour, we shortened that down quite a bit.
Thank you. Any questions? Go ahead.
And that's more for, I guess, for Ryan, but what's in the packet here for the build-out costs, it's for 2,500 square feet, and it's got a different dollar amount than what was on the slide up there, so.
I think we're using the build-out costs on here between 2,500 and 3,500 square feet. It's all just an estimate at this point. I think we'll probably settle somewhere in between depending on the services that we need. And I think the cost, I think in our contract, it shows an estimated of $500,000. That's going to be give or take. I know things have gotten much more expensive recently, building a high school. So I could see that kind of expanding up a little bit. And I'm hoping that with Blue Cross committing
$75 a year.
$75,000 for the first 3 years will help offset any increase that we see in those costs. So,
And mine's, I didn't mean to, okay. I say, what this allows us to do is, we have a high deductible plan for our employees, which lowers our premiums, which is lower costs for all of us. But when they go in to visit, they pay a one-time copay, so it's less burdensome on them, but it also gives us as the employer the benefit of offering a high deductible health plan instead of a Cadillac health plan. So that's where the savings occurs for us, and it allows us to control our costs, which we've been doing, but where we've been able to put it back into salary.
Yeah, this is sort of just a storytelling question because there was some wonderful stats in there, but I'm just trying to get my head around. We have a lot of young, families. For
Yes,
instance, in
absolutely.
the district. So just help me understand. So, for instance, I'm like a teacher and I have small children, and I might have a pediatrician, but I could also use Medalis for the family practice. Like all of my family could go to one doctor, and that would be our regular doctor. Or do you see sort of this also like you might have a pediatrician in one of the larger systems? I'm just trying to understand, like practically as a family, how it works.
No, absolutely. So you can utilize each different form, okay? There is definitely perks to having a pediatrician on board, specialized in furthering diagnostics and things like that. But for your regular wellness exams and your everyday urgent care needs, we'd definitely be able to service your entire family. Now, say that you have that young child and they have an acid reflux or a congenital heart defect, they're definitely going to see specialists. They'll need that specialized care. And so that's where I say that we're the gatekeeper. So we'd be able to take care of them and kind of bring everyone back to the same drawing board every single time versus going to see that specialist and that specialist and that specialist, but that specialist isn't talking to that one. So it just brings that full circle back around and kind of keeps it that closed loop communication. But yes, no, we definitely can service all levels from newborn on up for the wellness. And
Okay, thank you I needed the story told a little bit.
Yeah,
So
no.
Thank you.
Ms. Peel, if I may, the one point of contention that we've heard from our employees with families with young kids is, I hope we're trying to address this now, is that we're hearing to go in on our plan right now to get pink eye checked out is $180 at an urgent care. What we're trying to alleviate, the problem we're trying to solve is to go to Medalis, and then we're going to have a traditional $25 copay for that pink eye, for that walk-in, that urgent care need. I think that's really getting to what we're hearing from our employees, so I hope that's the problem we'll solve here.
And I just was curious about if it also was, I was trying to get to, yes, I understood that part of it, but is it that bigger picture where you feel like you've got a doctor and that's where your doctor is, your family doctor?
Correct.
So
And if I may, Mr. President, you do not need to be a Mandan school district employee to go to this clinic. Anybody off the street can walk into this clinic. And actually, there are several school districts. The city of Mandan Parks belong to North Dakota Fit, which is a health insurance plan, a high deductible health care plan. Their members will be able to go to this clinic and I think pay $35 for a copay, and then we get 10 back. So hopefully we'll recover some costs that way as well.
yeah, it's all about cost sharing and obviously having that open access to the patients to receive the fastest and most efficient care. We know the hospitals are bombarded and we can't get enough providers to be seeing them after hours with the specialized care that is out there. So we're just kind of that extra avenue, and it's at a discounted price of service just because we don't have all the overhead and the multiple avenues that are necessary when you're in the bigger healthcare systems. And with that, we also provide, like he said, to all individuals off the streets. So we take all major insurance carriers. We're credentialed with everyone. But we also offer self-pay rates for those that have high deductible premiums. Say a lot of our farmers around in the Jamestown area often come to our clinic and they have a membership with us. It's $60 a month. membership, so it's almost like an employer contract with us. And so we have a lot of farmers in our local area that come and utilize our clinic because their high deductible health insurance is $18,000 to $24,000, and honestly, who can afford that on a daily basis? So they utilize our clinic for that $1,200 a year, and their family can all be seen under that statute. So it offers a cost saving to everybody, as well as those that don't have health insurance can be placed on that, or they can be seen at our clinic for a flat fee of $175, which if you go to all the other institutions at the higher levels, that they require a set fee plus all the add-ons while they're in the clinic too. And so that is all encompassing. Yes, you're very welcome.
And for me, that has been around healthcare for quite a bit of my career in relation to it, the beauty that I like on this thing is hopefully the people that work for us will go in and see a medical provider rather than sitting and waiting for things to compound and get bad. And the one I think about is people that have pneumonia and they don't go in and they don't go in, and pretty soon they end up in the hospital. So, if they would have went in and seen the doctor at $25 and said they did an x-ray and says, hey, you need to have some medicine because you got pneumonia, and you take care of it then rather than it getting really bad. So I think that's some of the things that really can help in this case too for that, because it does happen. You talk $10,000 high deductible health plans. That's not what ours is, but you're talking 10,000. People are pretty reluctant to go in until they're pretty sick, and sometimes that's a little bit too long of a wait.
Yes, absolutely. And that's kind of our main focus is if we can't always prevent everything, but if we can reduce the risk and the comorbidities or death, that's our biggest portion of that. And he's said that absolutely perfect. Our greatest thing that we do see is our patients that have, say, walking pneumonia or pneumonia, they just wait till their fevers are 104 and that they can barely walk and they're no longer eating and drinking. At that point, you look like you should be in the hospital, and you start adding up those costs fairly quickly. And so if they would have been able to come into our clinic, like you said, for $25, 5 days before that, they could already be back to work, be back on their feet, and for $25 and say $15 for a medication, we could have avoided now a 1 to 2 week hospitalization, and or if they have other issues, the absolute worst is death. So it's definitely an opportunity to kind of increase our health awareness and our availability into the community and taking care of our patients.
Yeah, we definitely want to take care of our employees.
Mr. Chair, just a quick question. When, I love the idea, I love the concept and everything, and it appears to be a great program. Do you see any issues with staffing in the healthcare industry? Staffing is short in this area the way it is.
Yes, that is a loaded question for sure. Staffing, as you watch any news article out there, the medical field is extremely short around the nation and in the world, especially since COVID has hit. A lot of individuals have either retired out or just opted out to other avenues and professions. So my hope and goal is that we would be able to be fully staffed by opening, but the reality is that we do anticipate there could potentially be issues with staffing. Knock on wood, Fargo was by far the easiest to get staffed. I'm already fully staffed and all but 2 people are trained. And so opening day of June 1st, I have all positions filled. And I really didn't anticipate that was going to be what would happen, but I'm very thankful and excited to have that team join us. My backup and all of that is that we do offer floating positions from the staff that are currently in, say, Jamestown and now soon to be Fargo. So if we do run into a shortage, if those employees are set onto that standard that they're willing to travel and float, we'll be able to utilize them in the other cities. All 3 of our clinic operations would be set up the exact same, so it wouldn't be like having a new person in your clinic for that day because we are all operating on the same system, the same protocols and the standards, just be different faces for the day. And that goes the same with all of our labs and everything else too. So it's a very, very straight-lined process for all of those around the state because we do anticipate with our rural health care that if you're traveling to Fargo for the weekend and your son or daughter gets that sprained ankle, you can come on into Medallis over in Fargo for the same copay that you would have if you were over here in Mandan. It's the same for my Jamestown individuals. And so it's to try to keep everyone feeling like they're at home is our main goal and focus. So we're hoping that there's not going to be any employee shortage, but I'd be lying if I said that we wouldn't. But I I lived here for 15 years, and I have a lot of nursing friends that are really excited for this clinic potentially. So I'm hopeful that they are still as excited when I come knocking on the door and say, "Hey, are you ready to come work for me?" Yeah. Yes, absolutely. We're seeing that all around altogether for sure. Yep.
All right. Any other questions? Well, thank you, Ms. Reel. I think what we're going to do is, if it's okay with the board, let's jump to the new business section A. As long as she's in the room yet, let's talk about the contract in relation to it and move on that. So we just do it all in one piece. Is that okay? All right. Review and consider approval of the near-site clinic contract with Medalis. Mr. Legacy, I think you're going to be on the horn on this one because we asked you a question about costs, so go ahead.
Yes, we should update page 25, the very top line, is the administrative per employee per month monthly service fee should be $16 instead of $12. So that would be the change we'll make.
And is the weighted direct labor schedule guaranteed, the hourly rate for mid-level and hourly rate for medical assistants the same? Because I think when she popped it up here, they were a little bit different too.
I need to update those, we'll verify those. That I don't know, but I do know that the PEPM should be changed, that administrative fee, so.
Okay.
I guess I'll ask you a question. Are you okay approving as is and we bring an amendment to it so we can get going on this, or what would the board like to do? Table it for 2 weeks, or?
Well, that was my question. I was going to ask the board what they prefer. Are you okay with the, knowing that we're going to have a few changes in the dollar amounts of the contract and giving Mr. Legacy and Dr. Bitts the opportunity to correct it to where it should be? I'll leave it up to the board here.
Could you just briefly outline what those potential changes would be, so I have them in mind? The schedule.
So the beginning of the contract shows a 5-year fixed guarantee on those fees. And I'm assuming if it was 3 before, that's what caused the rise in the $12. So if
That's
we're all on the same page that it is a 5-year agreement, with the exception that that 12 is a 16.
Yes, that's exactly what it was. I do believe that we need to double check the fixed overhead fee as well. Double check that.
Yeah, everything was formulated for the 3-year, and so when it came back to the 5-year, my apologies if I didn't get all those numbers. We just set it for because on year 4 and year 5 there was the increase, and so we did the average of all of that, and so that's why the numbers were just a little bit. I want to say they're about $15 difference between altogether, if I'm not mistaken. But I will get the official numbers.
So that fixed overhead fee, what page is that on in the contract? You told us page 25 for that.
Page 25 is the fees and payment schedule.
That's still on that, so where do we have, oh, there it is, per patient visit fixed overhead cost. Right now it's at 44, so it'll probably be higher. Is that
I
the-
believe that those were updated, should have been updated to reflect the 5-year agreement, which we asked for the 5-year agreement. We wanted to make sure that we had that. And so I apologize.
Okay.
I think I have seen one of these that was correct, and then this one somehow got jumped in here at the end. So maybe it is best to bring this back in 2 weeks, and we can approve it at that point with the corrected schedules and have everything.
I'm okay with that. I mean, as long as it doesn't push off the timeline. I mean, I don't think there's any concern about it. It's just a matter of getting the numbers right is where we're really
Don't
at. Right?
think there's any sort of rush on a timeline to approve this. I think we're moving forward as is in 2 weeks when we're anticipating an opening of a year from now. I think we're okay maybe approving this and making sure that everything is correct and we don't have to bring it back again.
Okay, let's do that then. Let's just bring it back if everybody's okay with that at the next board meeting. We'll get it taken care of. We'll give you a chance to work through the numbers and make sure we got everything right.
Yes, absolutely.
Motion?
Do we need to?
We
yeah,
don't need a,
Not to table it? Okay.
we'll just bring it back as unfinished business then in 2 weeks.
Moving on then, thank you.
Yes, thank you guys.
Thank you very
Appreciate it.
much. Moving on then, June 11th, 2024, school board election. We're back on the administrator's report, Mr. Legacy. Just made you a doctor. Sorry.
Sorry, that's me too. Yeah, just a reminder, school board election is June 11th. Polls will be open 7 to 7. Your voting location is going to be the same as you would have for the primary election, so please check City of Mandan website, Secretary of State's website. They have all that information online. There will be early voting available June 5th through June 10th. I believe that's at the Mandan Library. Those times are flexible, so if you need to vote early, please double check that as we get closer to voting day. And also absentee ballots are available. You will need to apply through the Secretary of State's website, and those will get sent out from the county.
And a reminder for those running, we do have a report that has to be in by
By May 10th.
May 10th. So that's a new thing that they passed in the last legislative session. School board members that are running for re-election must fill that report out.
It's a
So,
campaign finance disclosure. I need that. I have most of them. I will reach out to those individuals I have not seen that from.
yep. So just a reminder to get them in. So, all right. So moving on, 24, 25, Title VI, tribal input. Dr. Rederath.
Yes, I'll do both these up here. As you know, because we're within 60 miles of Standing Rock Reservation, we do tribal consultation with them periodically on our consolidated app and also on our Title VI funding. And our Title VI funding is what we receive specific to the number of Native American students we have enrolled with us. And so we go down, we had an opportunity 2 weeks ago to go down there, Dr. Bitts, Travis Albers, and myself, and we just walk through what are the things we do with our budget. Right now, the vast majority of our Title VI money pays for our Native American Family Liaison position. We do have a bit of extra for some when they do different activities for materials and food and things like that. But the vast majority of our money goes for that position. And we had a great meeting with them. They signed off on that they're in agreement with how we utilize our Title VI funding. So that has all been submitted, and we should be ready to go for next year.
Great. Thank you. Next item is a construction update. And you're gonna do
Yeah,
both,
we thought
right?
we were just going to do kind of a quick update for the board. This should be in your packet as well, or pieces of it. I made it look slightly prettier today than what's in your packet. But just for reference, when you see on there the D and J wings are the front of the building when we're looking out, and those are our main academic wings. These will definitely be our first areas ready. We're hoping to start moving in items actually June 3rd. So that's less than a month from today, which is kind of crazy / exciting. Then when we move into F, lower F, locker room, storage, wrestling room, these will also be ready early June. The main level of F, the cafeteria and commons area, we're looking more at mid-August. There's just a lot of pieces in there. And then that upper media center that goes around the top of area F should be late July, early August as well. Just a couple of pictures. The one on the left is the commons area, looking out from the media center. And the one on the right is actually our main gym, and that's the walking track that they're putting in that steel that you see right in front there. Dr. Bitts braved the mud today and went up and got some of these pictures. So, and then just classroom, bathrooms, they're actually starting to look like spaces and what you can see what they are, which is exciting. Now looking into E, that's our kitchen area and maintenance shops. We're looking at mid-July, which is really good, so we can start testing things, making sure things are working appropriately. The upper level of that is our CTE office, nursing classrooms, our 2 fax rooms. Those should also be ready mid-June, we're hoping. Now, as we move into G, that's the majority of our CTE area, our shops. The classrooms in that area should be ready by late August when we start school. But our shops are going to be tight and probably are not all going to be done. We're prioritizing our welding shop first because of the amount that has to go into the welding shop as far as electrical ductwork, all of that, and working from there. And we feel like we might have a little more flexibility with some of the egg pieces in the fall of getting out and doing some things where welding, it's tough to weld when you don't have space to weld. So we're hopeful that those by mid-September will be done, but we know at the beginning of the year, those shops won't all be done. The one on the left is the CT shops on the outside, and then the one on the right is one of the end spaces in our academic wings. It has such a great view. Today was a little cloudy, but I plan to once a week probably move my office to one of those corners because it's pretty nice. Left is auxiliary gym, current storage / staging area for us, and the right is the science, one of our big science labs. So they're huge. They're coming together nicely. And then finally H. So H area is our fine arts area, band, choir. These will be, the classroom pieces will be ready before school starts. That includes band, choir, practice areas. Mid-July, we're hoping to have full access to this area. We know the auditorium's not going to be done. We've known that for a long time. We're shooting for Christmas right now with that. Area B on here is the auxiliary gym. That should be ready mid-August. C, the main gym is delayed. We're hoping to get in there before that 24th of September, which is our first home volleyball date. We've had to make some decisions, and we prioritize classroom space where we had to have classes going and kids going, and you can't do it all at the same time. So hopefully that's ready early mid-September, but we know that that's going to be a bit delayed. And then, as always, A is the hopeful future pool that we're not doing right now. So I believe that is it. Does anybody have any questions?
Thank you. Any questions?
I think, Dr. Bitts, I've heard you mention before, and Dr. Rutterath, you could certainly address it too, but, you know, a lot of those fall events for fine arts.
Yeah.
About the auditorium. What's the plan for those fall concerts and programs?
I did meet with Mr. Bauman several months ago. I don't remember the date, and I told him that, and he said, yep, he was very aware of it, and he goes, can they practice marching band? I said, yes, they're welcome to keep staying where they are at the old building and do marching band this fall. And he said, and if we'd have a concert or two this fall, that would be okay too. And I said, that would be wonderful. So I think that that's a possibility. He couldn't have been more understanding, just gave me a thumbs up. I think they're excited about their space. They understand the realities of the auditorium. There's just so much finish work that goes into that. I would love for it to all be ready on day one. It just is not a reality.
We can't have it all. It's
No.
going to be a phenomenal space. It's going to be worth the wait,
Yes.
but I know that our community is concerned about being able to go to those performances and have
Absolutely.
for kids.
I toured Mackenzie County High School, Watford City, when they first opened up, and we're walking along, and I said, "What's in here?" And he goes, "I'll show you." And he showed me inside, and it was their auditorium that was. He said it's going to be another 4 or 5 months before we're in here. So I think that's pretty standard. Moorhead, we went and visited them over in early January. They won't be in their auditorium for a whole another year. So it's quite common that when you move into a school that your auditorium is delayed.
And just so you're aware, our plan is to update those same slides periodically throughout the spring and summer on the same points to provide to you and also to the high school staff to kind of keep everybody in the loop of where we're at tentatively with some of those timelines as we move forward.
We are also meeting tomorrow before school and after school with the high school staff. So they can come to one staff meeting or the other and get the same update.
Great. Any other questions? And just a reminder, we'll talk about it here at the end, but on May 13th, the board plus all three of our committees are going to have a tour of the high school, also the new high school, at 5 o'clock. So just throwing that out there, so we'll all get an opportunity next Monday to have a tour through it. It's Monday, right? Yep. All right, moving on, we'll go to the consent agenda. Items on the consent agenda: review and consider approval of previous board minutes from April 15th, 2024, accept the health insurance minutes from April 16th, 2024, accept Facility and Finance Committee minutes, April 29th, 2024, accept the Heart River Career and Tech Ed minutes from April 29th, 2024, review and consider approval of technology lease with Apple, review and consider approval of copy lease with Marco, review and consider approval of a second final reading of the following policies: JU students in foster care, JUA foster care student transportation procedures, DH bonded employees, DI accounting and reporting, DID audits, DJDA travel authorization and expense reimbursement, DJE purchasing personal gain, DJED bids and quotations, DK student activity funds management, DO school properties disposable, DFLA district student investments, GBAA release of contracts and liquidity damage. And just a comment here, you'll notice there we got two tech leases in here, one with Apple and one with Marco. Dr. Bitts and I talked about when we were putting the agenda together. I put them on here because they're kind of a standard contract, administrative type contract in relation to it, but they're fairly big dollar amounts, so we wanted to make sure the board was aware of them, and I thought the consent agenda was a good place, so if anybody wants them pulled off, I would gladly do that. But we thought we would throw them on here rather than have separate discussions in relation to them, so what are the wishes of the committee?
Can we still discuss the items?
Then pull it off. If you want to talk about it, we'll pull it
Okay.
off the committee.
I'd like to pull it off, just because I have one question.
Which one? For both?
For both, yeah.
Okay, we'll pull both of them off then. And we'll put those under new business, D&E.
Thank you.
All right, what are the wishes of the consent agenda minus the two leases?
I move to approve the consent agenda as amended.
All right, do we have a second? Second. Okay, we have a motion and a second. Mr. Legacy, please call roll.
Yes.
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 Yes, we have no unfinished business, so we'll go into new business. The first item there was the near-site clinic, which will come back as old business under the next meeting date. Next item, review and consider approval of an addendum to the negotiated agreement with the Mandan Education Association. Dr. Bitts.
Correct. In your packet, we negotiate with our teachers every 2 years. Sometimes it's a quick time frame, a quick turnaround, and we negotiated last year, and it says that the contract can be changed by mutual understanding. Our CTE, or our teachers who are our career and technical education advisors, came to us and said, we are severely underpaid, this isn't right. We did some checking, not only for them, but for our coaches. Our coaches are, I won't say well compensated, but we're in the ballpark with what we pay them. Our CTSOs, our DECA advisor, our HOSA advisor, our AG programs, what am I missing? Skills USA, we were really low. We kind of met with them, kind of tried to get them apart, and we can, to put them where we should be is going to be about, at maximum, $26,000 per year. We would like to pay them that way next year, and then just insert that into the agreement. I think it's the right thing to do. I think we're going to end up doing it a year from now. I would like to pay them that way next year. MEA is in agreement with that, and my hope is that you can support doing that as well. We have great CTSO advisors, and we want to compensate them fairly.
And they've agreed off on it, right? Because I'm just
They
looking
have.
here
They
at
have signed off. I don't think I put the signed copy in the packet. Oh, okay. She did sign
It
it.
is.
Good. Okay.
Any discussion, any questions for Dr. Bitts on this one?
I just had one comment.
Go
Just, I'm really grateful that we're flexible in that way. I think this is so important, and it sends such a good, it's just such a good message as to how we revere and appreciate our teachers and the work they do. So I'm just really grateful for the flexibility and that we're able to do this, both from the MEA and from administration. So thank you.
All right. Any further discussions? Seeing none, what are the wishes of the board?
I'd make the motion to approve the addendum to the negotiated agreement with the MEA.
All right, we have a motion, we have a second,
I'll second that.
and we have a second. Any further discussion, comments? Seeing none, please call roll.
Yes.
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 Yes. Next item, review and consider approval of the following teaching contract. Amanda Moldenhauser, English learner teacher at elementary level. Dr. Bitts.
Correct. We have been short an EL teacher for a long time. We keep getting new EL students. EL is English learners. This will give us a third teacher at the elementary school. We have EL students in every building. I guess we have over 150 EL students, and this is just a needed position. It is a new position, but it would be our recommendation that you approve it.
Glad you could find somebody.
We've been advertising for a year. We finally found someone, so.
All right. Any questions, comments, or what are the wishes of the board?
I move to approve the teaching contract for Amanda Moldenhauer and welcome her to our district.
Second.
And we have a second. Any discussions, comments, questions? Seeing none, please call roll.
Yes.
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 Yes. Next item on the agenda, which come off the consent agenda, was the Apple lease. Ms. Kazad?
Yes. For comparison's sake, I mean, I know that it's standard contract and we do these, but I'm curious about, it's a $2.2 million contract. How much of an increase is that from our last contract? Is it pretty consistent with our last?
It's an increase, and our last contract, we had a lease, and first of all, we got more devices now because we have more kids, but he's going to go back and try to look, but we also, the ink wasn't even dry on it, and we paid it off because we got ESSER dollars, if you remember. So I keep telling us that we haven't had this on, it's a 0% interest. I don't like leases, but when you have 0% interest, you do it. It's one of those things where it's just an ongoing expense. We have not had this in our budget, so we're choking on it now. It's kind of like when you don't have a car payment and suddenly you do have one again. So we have to add this to our budget next year. Mr. Legacy just shared the budget with our facility and finance committee, was it last week? And, he included it. He said that's one of the new things that we're not choking on, but it's a new cost for us. I don't know if you can.
It wouldn't necessarily
I can get that
sway
answer for you. I
my
can't.
vote, but I'm just curious, everything has gone up in cost, plus we have a lot
More
more
devices,
students
right.
and more devices. So with our old devices, when they're returned from lease, what value do they have?
Thank you. I'm so glad you asked that. We will sell back to them, and we're going to get a cash payment for that, which will lower this amount. So
It's just over.
and it's different we have devices of all different ages and all different, I don't know,
value.
conditions. There we go. That's the word I'm
Condition
looking
value,
for.
Yeah.
Yes.
Our previous lease was $2.3 million. However, that included new teacher laptops. This lease in your board packet does not include the teacher laptops, which we are buying, which will be an additional, I want to say roughly $500,000. So we're $400,000 to $500,000 more in technology than we were in 2020 when we signed the original lease. But there are a lot more devices, especially iPads, we're purchasing this time.
All right. Thank you for letting me. No problem. Again. So I move to approve.
Do I have a second? We have a motion and a second. Any other discussion? That's why I brought it up, to say we could pull it off. Mr. Legacy, please call roll.
Yes.
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 Yes. Yes.
Yes.
Yes. And then we'll talk about the Marco lease. Suzanne.
Very similar questions, right? And I think maybe I'm misinterpreting the final page on this that has it as a 6-month. Marco all-inclusive NASPO. So what happens after 6 months?
Let me get there.
It's on page 30 of our packet, page 9 of the contract. It says recommendation financials, number 131 contract, $13,495 a month for 6-month all-inclusive.
I'm looking at Kevin Johnson from
Should be
Marco right
60.
now to answer this question
Right,
for
well,
me.
it should be 60, so that's a typo, okay.
Yes.
Oh, very grateful that you're here then, right.
So the dash should be a 0, is what you're saying.
Okay, that makes a lot more sense than us going into a 6-month contract, okay.
Yeah, and just in comparison's sake, our previous lease was $14,300 a month, so we're going down to $13,500. That's not out of the kindness of Marco. That is, we're reducing devices throughout the district and working with Marco to kind of make our printing and copying a little more efficient through our buildings.
So the money we're saving with Marco, we're going to send to Apples.
Perfect. Well, in that case, I move to approve our 60-month contract with Marco.
All right, we have a motion, we have a second.
Second.
We have a second. Any further discussion? Mr. Legacy, please call roll.
Yes.
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 Yes. Yes.
Yes.
Yes. Next item on the agenda is future meeting dates. May 13th, student achievement at 4 o'clock at the Brave Center. May 13th also. All 3 committees plus the school board, I think, are included in this case in relation to it because they're all on the committees. 5 o'clock tour of the new Mandan High School. Dr. Bitts or Mr. Legacy, where do you want everybody to meet?
We said we would send something out. Hopefully it's gonna, I understand we need the moisture, but we don't need the moisture at that site. So my hope is that it dries out a little bit and we're gonna send parking directions out, probably that day. And
Just so everybody's aware of
Yep.
that. May 20th, regular school board, 5:30 City Hall. May 25th, Native American honoring, 10 o'clock at Century High. May 26th, graduation, 2 o'clock at the Starion Sports. That's another day we don't need any rain. And June 24th, regular school board, 4 o'clock, City Hall. Is there any other meetings that should come before the board? Seeing none, this meeting's adjourned. Thanks, everybody. Thanks for joining us.